Let's talk about pharmacology and teaching because, as I mentioned before, a lot of the pharmacology questions on the NCLEX deals with teaching. All nursing care, or most of the NCLEX style questions, are directed towards promoting, maintaining, and restoring health and preventing illness, and also helping people adapt to the residual effects of illness. In other words, there is a category on the NCLEX that is called health promotion and maintenance. There is a specific category for that. So a lot of the questions on teaching on the NCLEX and pharmacology deals with promoting or preventing. This is why part of the teaching that we include to the patients and family, you have to monitor for side effects. You have to monitor for adverse effects. If you see this happening, you have to call the doctor. If you see this happening, no need to call the doctor. It's an expected side effect of the medication. So a lot of questions on the NCLEX deals with this. So learn what is asking on the stem of the question, because many of the nursing activities, okay, or answers on the NCLEX deals with patient education. One of the goals of patient education is to encourage the patient to adhere, to follow a therapeutic regimen. What is one of the problems that we see very frequently with patients and medications? That they don't follow the regimen. They don't adhere or follow the therapeutic regimen. And there are some medications that if the patient doesn't take it exactly as it is prescribed, is going to affect the therapeutic range of the medication. The medication is not going to fall within the therapeutic range. It could be either subtherapeutic or in a toxicity level. So a lot of the question on the NCLEX deals with asking question and validating whether the patient is following the regimen or the exact physician order for that specific medication. So do not assume that all the questions are always going to be about the intended effect or side effect or adverse effect of a medication. It could be as simple as asking a question and validating when the patient is taking XYZ medication. Are you taking the medication in the morning? Are you taking the medication at night? How is the patient following the regimen, therapeutic regimen of that prescription? Now, there are a lot of scenarios that could cause a patient to not follow the order of the doctor. There's a wide range of variables influencing the degree of adherence for that specific medication. And I want to discuss some of these variables. One, demographic variables. What do I mean? What do you mean, Professor Ray? Demographic variables, meaning age, gender, race, socioeconomic status, and level of education. And you may ask, well, what does age, gender, race, socioeconomic status, and level of education has to do with medication adherence? What is the relationship? Well, very simple. If the level of education of the patient is lower, the patient may not understand the instructions that the doctor gave to the patient. The patient may not understand the importance of following the medication regimen. What does age have to do with medication adherence? Well, if you have an elderly patient, the elderly patient can be confused, can be forgetful, forget to take the medications. How many times we see the elderly population overdosing on medication? Because they forgot to take one dose and they assume, oh, I forgot the morning dose, let me take 2 doses back to back. Or actually, I forgot yesterday and the day before yesterday's dose, and today I'm going to take all the doses that I missed for the past 2 days. What happens? Medication overdose. So age is an extremely important factor to determine if a patient is going to or not going to follow the medication regimen or adherence of the medication instructions or pharmacology instructions from the doctor. Another factor is illness variable, such as the severity of the illness and the relief of the symptoms afforded by the therapy. In other words, let's say you're dealing with a patient that has a chronic condition, and doesn't matter how the patient takes the medication, the patient sees that he's taking the medication for a long period of time, and the symptoms not necessarily improve. The patient continues to deteriorate. There could be a time that they go, enough is enough. I'm not taking any more medication. So that is what is called an illness variable. Another variable is therapeutic regimen variables, such as the complexity of the treatment itself, fatigue, or important one, uncomfortable side effects. So a lot of times we see that patients don't take medications and we think that they're just being stubborn. They're just not following the regimen because they are being difficult. But sometimes they cannot deal with the uncomfortable side effect, common side effects that could be experiencing from taking those medications. So it is important to teach the patient about the side effects that they could be experiencing, because they might think, oh, if I get dizzy, then that means that something is bad with the medication. No, we have to teach that sometimes dizziness could be an expected side effect of the medication. Another factor is psychosocial variables: intelligence, motivation, availability of significant others, support from other people, family members, attitude towards healthcare professional, acceptance or denial of illness, substance abuse, religious or cultural beliefs. Some cultures don't believe in pain medication. They think that if they take a pain medication, they're being evil. So we have to understand how these psychosocial factors or variable could influence on a patient following or not following a specific medication protocol. And lastly, financial variable. Sometimes the cost of the medication is too much and the patient does not have enough money to pay for that medication. Well, maybe the patient needs some social help. Maybe we gotta get the case manager or social worker involved to find some assistance for payments for the medication.